Hi, my name is Walker. This is Karen. We are a couple of the MAs on staff with Ogden Clinic Weight and Metabolic Center. Today we're going to teach you how to properly prepare, dose, and administer your compounded GLP-1 medication. Before we begin, we have 6 major rules that are very important that we want to get out of the way in the beginning here. The first one is to do some kind of hand hygiene before doing your injection, whether it's washing your hands with soap and water, hand sanitizer, whatever floats your boat. Rule number 2 is your medication should stay in the fridge in between injections. It doesn't matter to be a specific temperature, just as long as it's in your fridge. Rule number 3, this is a weekly medication, so you'll do it on the same day each week. The time of day doesn't matter as long as it's on the same day. Rule number 4 is you should not change or adjust your dose at all unless you are specifically informed by your physician to do so. Going rogue with your medications and adjusting it on your own is the fastest way to land yourself in the PR. Rule number 5 is that you should use a new syringe every injection. Do not try to reuse them. Don't try to clean them. If you run out of syringes, just let us know. We don't make you pay for more. We can just supply you with more. Just call up the office and let us know, and you can stop by and pick more up. And then finally, rule 6, make sure that you keep track of how much you are giving yourself each week and how much you have left in your vial. And then make sure you give us no less than 2 weeks notice when you need a refill. Let's just make sure that we get everything taken care of in time, that we don't risk you missing an injection. Okay, let's begin. So start out, you'll just want to make sure you have all of your supplies prepared. So that's going to include the medication out of the fridge, a syringe, and the alcohol pads. You're going to want to use 2 alcohol pads with each injection, one to clean the vial, one to clean the skin, and we'll get to that later on. If your medication is a brand new vial, it will still have this little cap on the top here. You can just take that cap off and it can just go in the trash. You don't need it anymore. Next thing you're going to want to do is gently roll the medication, the vial, in between your fingers. This is just to mix up any of the sediments in the combination that could have settled at the bottom of the vial, just to make sure that the medication you give yourself is a full dose. Our next step is to clean the top of the vial. So you'll take one of your alcohol pads, you'll just take that out, and you're just going to scrub the top of the vial just for 5 to 10 seconds, just to give it a good scrub. Once you've cleaned it, just set it to the side, let it dry, and don't touch it again until you're ready to put the needle in, just to keep it nice and clean. Next thing we're going to do is just show you the 2 different types of syringes that you might get. They just have different measurements on them, just depending on how much of a dose you have to give yourself. So one of them will only go to 30 units. It's the smaller of the 2. The other one goes up to a full ml, which is equal to 100 units. So it's just the larger of the 2. So just depending on what your dose is, if your dose is more than 30 units, you're going to have the larger syringe. If it's 30 or less, you're going to have the smaller syringe. Next thing we're going to do is aspirate air into the vial of medication. This is just to equalize the pressure inside of the vial to avoid there becoming a vacuum seal. It just makes it so it's easier to get the medication out. How we're going to do this is whatever your dose is of medication. So on your prescription, if it says, for example, 10 units subcutaneously every week, that means we're going to be taking 10 units out of the vial in medication. So we're going to put the same number of units of air into the vial first. You'll take your syringe, you'll pop that back orange cap off, and then you can pull down on the plunger to get to the dose. You're just going to go to the number it says on your prescription. So if it says 10 units, you're going to go to the 10 on the syringe. Then you can take the top cap off and you'll stick the needle straight into the middle of the vial. And then you can just push that air in. Once that's done, you can then flip the vial upside down, and this is where you'll draw the medication. And again, you're just going to draw straight to whatever your dose says on your prescription. You'll want to make sure that while you're doing it, you're getting a full dose. Sometimes the medication will be clear. Sometimes it'll have a pink tint to it. If it's a pink or red color, it just means there's B12 in it. If it's a clear one, that just means there's no B12. You can kind of flick the syringe if there's too many air bubbles in it, and you can sort of push those air bubbles back out. Just try to avoid too many big air bubbles. If there are some little ones, it's not a big deal. It's not dangerous. This isn't going in a vein or into an artery. It's just going into the skin, so there's no harm. It's just that you won't have a full dose if there's air in there. If you're not going to immediately give yourself the injection, you'll want to carefully recap the needle. That way you just avoid poking yourself unnecessarily, and then you can just set it to the side until you're ready to give yourself the injection. Next, we are going to prepare the skin for the injection. Now you have a few different places in which you can inject the medication. It's really up to you, just whatever your preference is. If you're going to be injecting yourself, we recommend doing it either in the stomach or in the inner thigh. It just needs to go more in the subcutaneous fatty tissue rather than in the muscle. If you do the stomach, just make sure you're at least like an inch or two away from your belly button. If you have someone that's going to administer it for you, an easy place to do it would be the back of the arm. Karen is nice enough that she's going to let me demonstrate for you, so I'll be doing it on her arm just for ease. Well, I'm wearing gloves. You don't have to wear gloves at home. This is more so just because we're healthcare professionals. So you'll take your alcohol pad, and then just the area that you're going to be poking, you'll just take the alcohol and just clean that area really well. Again, just scrub it for a good 5 to 10 seconds. Leave it alone for a minute, let it dry completely. Normally when patients complain of injections burning, it's not always because the medication itself burns. A lot of times it's because the alcohol isn't fully dry. So when you stick the needle in, the alcohol goes in with it, and that's what causes the burn. Then you'll take your syringe, you'll pop that cap off again to expose the needle, and then you're just gonna go in at a 90-degree angle straight into the skin and then inject the medication. You can kind of just grab the skin to give yourself some hold there, and then you're just going to go straight in, inject, pull the needle back out, and you're done. Next thing you'll do is just very carefully, you'll want to dispose of the needle properly. If you have access to a sharps container, that's the ideal place to do it. If not, a lot of our patients will opt to just put their used syringes in a Ziploc bag, or sometimes we will supply you with a biohazard bag. You can put the used ones in those, and then the next time you come in for an appointment, just bring those with you, and then we can get rid of them for you. Like I said earlier, just make sure you're not reusing syringes, and if you run out, let us know. We can give you some more. Hopefully this was helpful. If it wasn't, let us know. We can answer any other questions that you might have. Have a good one.